Results of a comprehensive survey of more than 2,300 physician leaders found that 47% of respondents said their organizations conduct some kind of physician leadership development program. Another 16% said they are aware of plans to create a program. The survey was conducted by the American Association for Physician Leadership and the Navigant Center for Healthcare Research and Policy Analysis. Peter Angood, President and CEO of the association.
In the industry, there is an increasing awareness of the need for improved physician engagement, integration of physicians, and then as that occurs, there's obviously a natural movement towards having physicians engaged in the leadership aspects of different types of health systems.
Paul Keckley, Managing Director at Navigant, says some healthcare organizations simply put a doctor in a leadership role without providing formal training.
Where it tends to be locked into a kind of traditional model, or there are about 1,700 of these kind of community-based healthcare organizations where, for budget purposes or otherwise, this is a doctor that's practicing full-time still and has a role, part-time clinical practice has a role, full-time administrative function but retired from clinical practice. And that's not the progressive model. That's kind of check the box. I've got a doctor in the C-suite.
So what do physician leaders need to know? Among other findings revealed in the survey, 63% of the respondents agreed that business knowledge of purchasing goods and services for the organization was important. 65% considered negotiating with lenders or investors to be important. 78% said evaluating risks associated with acquisitions or new businesses is important, and 90% of the respondents said understanding finances and access to capital is important. Keckley says another key competency is communication.
We underestimate the importance of communication. We presume that that's easily done and somehow it's intuitive. We can teach communication. And I think I see a lot of clinical leaders who think they're communicating and don't. I see it a lot.
The association has identified these 16 competencies as important for successful physician leaders.
Yeah, our organization has embraced these 16 competencies, and as we all know, there's a plethora of leadership competencies out there. And I'm going to hedge my answer and say that no, there isn't a specific competency or a couple of competencies that I think are more critical. I think what we're understanding better and better is that yes, there are some competencies which you would classify as more business-oriented. They're kind of like management principles, if you will. But then as it relates to leadership, it's all about people, and it's how do you help manage and lead people, and those are where the softer people-oriented skills come in.
Those are just some of the findings of the Physician Leadership Survey. For complete survey results, visit the association website at physicianleaders.org.